It's cool to see grow over time that we've seen patients that go from, doing slowly 1 every 6 months into doing 6 to 10 a month.
The biggest thing is helping to understand what the patient needs. I think that's where we're coming from more than anything. We can educate all day long unless we're really meeting the needs of the patient, whether it's functional, where they're not eating properly or they can't socially, they don't have the confidence to be with their friends and loved ones, pain, infection. I mean, those are all things that we want to make sure we're providing a solution for.
There's all these offices out there. There's all these, especially GP offices that are struggling, right? They're like, oh, I thought it was going to be easy, but it is hard. It's not easy, right? If it was easy, everybody would just do it. And that's not how it works. Welcome back to another episode of the Full Arch Advantage podcast. I'm your host, Gary Bird. I'm the founder of SMC National, where we help you create, convert, and close more full arch cases so you can grow the way that you want. And today I have Nikki, who is the treatment coordinator, and Dr. Miner, who they're doing around 10 arches a month, and they're doing it in a way that most offices haven't figured out yet. If you're a GP office trying to learn how to get your patients that already are coming into your office over to doing more arches, this is going to be an episode that's going to really help you out. Stay tuned. All right, we are live, and I'm excited to have this conversation. Nikki, why don't you tell us really quickly, just roughly, how many arches are you guys doing a month right now?
I would say typically we're going to be doing anywhere between 6 to 10. Dr. Miner likes to do about 2 surgeries a week. We've kind of found that as our sweet spot, that's our happy spot when it comes to, not feeling overworked, but also giving like the patients as much attention as possible too. We typically do all of our try-in appointments, consults, all of that on Tuesdays, and we're doing full days of surgeries on Wednesdays and Thursdays. So I would say typically anywhere between like 6 to 10 is typical.
That's amazing. And so what would you say, Dr. Miner, is like the main engine that drives that growth? If you're doing 6 to 10 arches a month, where are those coming from?
Oh, I would say a lot of that comes from just our existing patient base and my general practices. But also, we do marketing, and we are able to capture patients who are interested in this type of treatment through marketing efforts, which is necessary, I think, when you're doing full arch. But yes, I mean, it's been one of the best things that I've added to my practice, that the patients that we have in our existing practice who, I would see before with completely unrestorable dentition, to be able to offer this as a treatment option that's predictable and more definitive has been really great for our practice.
Yeah, that's huge. I know it helps a lot of people. And it's always, from everybody I've talked to from a clinical perspective, it's the most rewarding treatment because, if you do somebody's filling and they're in a little bit of pain, they're like, all right, thanks. But when you give them their smile back or their ability to eat or those kind of things, they like cry in front of you. And they're like, it's life-changing.
Yes, it is. And it's awesome for us to be a part of that change for people. We have come to really just love it as something that we can help them through. We have a great team. It's not just me, obviously. And there's Nikki, and I have 2 assistants and a hygienist who's dedicated to this, helping support our patient the whole way through. And I think that's really important as well. To make sure that they're taken care of, not just during treatment, but after. So we are making sure that they have a solution that lasts them a lifetime, hopefully. That's our goal.
Yeah, that's huge. Mm-hmm. Now, what I'm curious about, because a lot of GP offices really struggle with implementing full arch. So usually what happens, this is just normal experience that at least for a lot of the doctors that I talk with is like, hey, we're a GP office. We want to add full arch. The doctor goes and does some courses and they maybe train their dental assistant and they're like, all right, we're ready to go. But it's not that simple, right? There's so many other things. Yeah. Even if you're the best clinician in the world at it, there's a lot of other things that have to happen. Hey, Happy New Year. And thanks so much for listening to the podcast. I'm sorry to interrupt, but I got something really, really important to share with you that's going to bring massive impact to your practice. So every year, things change in your market. Every single year, people move, incomes change, populations change, and it's really important that you stay up to date with that. And one of the things that we offer to all of our customers, and we want to offer it to all of our listeners completely for free, is mapping out your new patients. So we're not going to only show you where your new patients are coming from on a map, just like this above, but we're also going to show you the income areas that they're coming from, the different pockets of income, as well as the populations to make sure that you have supporting areas to where you can attract more new patients. And lastly, we're going to map out all of your competition for you for free. This is 100% for free, no obligation. And we're really excited to share this with all of our listeners. So all you have to do is go to maps.smcnational.com, and it's first come, first serve. We're not going to offer this forever. So if you want to get this, get in now, get all your new patients mapped out for the new year. We're looking forward to talking to you soon. Thanks. So can you kind of walk me through what your process is as a GP office that you're kind of mining out those full arch cases? Nikki, maybe if you want to kick us off, and then Dr. Miner.
Yeah. Well, it's kind of fun because I've been along throughout the whole process that we kind of started from the ground up, right, Dr. Miner? I mean, we've kind of started with just a couple every couple months that we were just diagnosing patients of, hey, dentures probably aren't going to be the best options. Like this is something we're just starting and getting into. And it's something it's cool to see grow over time, that we've seen patients that go from, doing slowly one every 6 months into doing, like I said, 6 to 10 a month. That it's cool to see Dr. Miner's growth over time, and also see the Highbridge team grow over time, because it started out just kind of 3 of us, that it was another assistant and me and Dr. Miner, and it was just us, and we were on board and ready to go. And it's taken off from there. And it's been the last almost 5 years of us doing that. And now it's her primary focus, which it was GP stuff before that. So it's pretty cool to see her practice change too.
Like one of the processes that we implemented during COVID that I think has helped tremendously is Nikki during virtual consults. So we have, we have leads that come in either through marketing or even our existing patients who express interest in this treatment. And Nikki meets with them virtually on a Zoom type meeting through a medical app. But she has a presentation that she does that it's almost based on one that I initially, I would invite people into my office and do like a presentation with them live. And Nikki does that virtually, and then helps them just clarify what they're looking for, where they're at, where their pain points are, how we can help them, and also helps confirm if it's what their budget is, because we really try to serve all budgets, so we want to make sure we're coming up with solutions that in the end just get that patient to a better place that's healthier for them and just a better quality of life.
Oh, I love that. So yeah, because one of the problems with full arch marketing compared to like GP marketing. So GP marketing, if you want 100 new patients coming through hygiene or the doctor's schedule, maybe you need 120 leads, maybe 130 leads, right, to get to that 100. But for full arch, in marketing, now this isn't for patient referrals, but for marketing, you need about 50 leads to 100 leads to get that one interested patient. So how do you, Nikki, I would love to hear, I hear that you're doing this presentation, which is really cool. Are you doing that for tons of people all the time? Like, is that the bulk of your job? Or do you have another filter system before that?
Yeah. So, I mean, it's a large portion of what I do all day. Like I've met with 6 patients today that I've talked to. It's either on the phone or it's going to be on the virtual calls. It's filtered first by phone calls. And if they're interested, I schedule them virtually to meet with me, just kind of go through everything. I like to show them I'm a visual person. I'm educated by videos, pictures, models, all that kind of stuff. So I in the presentation, I like to show that as much as possible. So then by the time Dr. Miner's talking to them, they've seen it. They know what it looks like. They've seen before and afters that she's done for patients. So I would say it's usually like 6 to 1 of them wanting to come in and then see us and then start. So there's definitely a bulk, and then the ones that want to start with us and continue in treatment. But then there's the patients that we see in office that don't, accept treatment, but that we've met with. So there's always a filtering system, and we've kind of honed in on what works.
Yeah, that's really good. Dr. Miner, could you just give me, because I know you created the presentation, could you give me the nuts and bolts of it? Like what, if I was a doctor and I wanted to create
Nikki
it,
is
like
very
what
helpful.
would,
So, I think that the idea is just helping people understand what the treatment is. Most of the time, with clear choice and things like that, they're coming to us with some idea of what it is that we offer. But and honestly, the biggest thing is helping to understand what the patient needs. I think that's where we're coming from more than anything. We can educate, all day long, but unless we're really meeting the needs of the patient, whether it's functional, where they're not eating properly or they can't socially, they don't have the confidence to be with their friends and loved ones, pain, infection. I mean, those are all things that we want to make sure we're providing a solution for. So understanding that. And then what's nice is by the time they do get to me, I have that information ahead of time. So I'm already coming and formulating a treatment plan that I feel like it's going to be, meet their needs. We've already established somewhat of a relationship with them because Nikki's met with them ahead of time. And I think overall what has happened is just a more effective use of time. I think early on, I was meeting with those patients initially. And, once you get busy,
that's a lot.
You don't have time. I still have time to give to the patient that they need and that they deserve. And so Nikki is able to do that for me. And then I'm able to just really come up with the treatment solutions. I love that. And then Nikki also offers, the other aspect is financing, cost and all of that. So
that was actually my next question for Nikki. So 2 questions on the qualifying people financially. So number 1, how do you do it for the marketing people, right? So there's different ways that you can do that because honestly, you can really offend people if you ask it the wrong way, right? I'm sure you've probably been stuck in those positions before. But the other thing that popped in my mind, when you're dealing with existing patients, you have to be very careful, right? So like in the good old days, we used to just refer this kind of treatment out. And if the patients couldn't afford it or didn't want to do it for whatever reason, it was kind of on the other doctor that they talked to, not on the GP office. But now there's that fine line where you kind of have to walk through this. So walk me through how you financially qualify people that are new to your practice. And then let's talk about how you do it for the existing patients.
Yeah. So from a general side of patients coming to us from the Mound or the Chaska office, a lot of times they're having that conversation with them saying, if you're not interested in dentures, Dr. Miner offers something that involves implants. Now that's a more expensive option. They know that coming in to talk to me that I'm going to be calling them. And so by the time I talk to them, they say, I heard it's expensive. What options do we have? And I say, we've got lots of different financing options. We can sit down and apply. We do all pre-qualifications that aren't a hard hit on your credit. Do you have an idea of what your credit score is? I think that's just a general idea of that they identify, I don't have good credit or I do have good credit. And if they don't, then that's a conversation of, hey, we might have to talk about a cosigner, or let's talk about going to a credit union or something like that.
So you're working through, I just want this for the audience, which is really good. You're working through problem solving with them. It's like, I don't have the credit. I don't have the money. Cool. Let's help you figure out how to do that. It's just like not a no at that point, right?
Yes. Yeah. I would say that I try to help. I exhaust every option that I can. And we've got lots of financing options. So I say I'll allot as much time as I can to go through every single one. And if everyone says no, I'll still give you options that are outside of our office that I know of. And that conversation's across the board. That's not really different from general practice to new patients coming in. I mean, it's the same question. Do you need financing? And then I kind of generalize it as, I know I don't have this sum of money ready to just plop down for treatment. And if you do, great, congratulations. I'm really excited for you. And if you don't, great, then you're the majority. You're like me. And let's talk about financing. What is your credit score? And then I have a general idea of when it comes to our financing options of which ones are approving which credit scores and which ones to start applying with them.
Awesome. And so then, what's your go-to right now for financing? What are you kind of doing there?
It's been Proceed. for a really long time proceed financing, I'm finding that their interest rates are really high, that it almost offends patients. And so I've started with Allegro currently and Moment, and that's been a lot better. So
Allegro is through Care Credit, is that right?
Yeah, they're a sister company of Care Credit, but they're kind of separate, but a sister company of them.
And then what was the other one? I haven't heard of the other one. The Moment?
Moment financing.
What is that?
Yeah.
Tell me a little bit about that.
So Moment financing, we're pretty new to them. But they're a company who has like set rates that they can't go above, let's just say 13% for the patient. And then it's a set rate for us, like as a provider fee. And so Dr. Miner and I sat down and looked through them and it's like, these are the ones that we're interested in. And we can usually pick 3 or 4 of them. And usually they're approving patients with credit scores of, I want to say it's like 640 plus. So if a patient says, I've got a 650 credit score and I don't want my interest rate to be above 15%, I know that we can start there with them.
That's awesome. Dr. Miner, as you start to work with these patients, is there anything that you're adding in to get more referrals from the patients, or is it just something that naturally happens by taking care of the patients?
Yeah, I think it naturally happens. I wouldn't say we let people know that obviously we always want to help whenever people just bring it up, really, they say they told somebody about us. I guess I intentionally have Nikki reach out. I'll ask if I can get their contact information and I'll ask Nikki to reach out to whoever is interested just to start that relationship. But we don't do any kind of promotional things for referrals, I guess. Sometimes I know that can be something beneficial. I'll just add too that as far as the cost, you had mentioned when you refer out to a specialist. I think the one thing that is so great now about technology and the predictability of these surgeries is that, and that it makes it so that I'm confidently able to do from A to Z. And we have great outcomes. And I think overall, because of that, it decreases the cost for the patient. Whereas if I were referring these surgeries out and just doing the restorative aspect, I think overall, the patient cost would be a lot more. So,
what are you normally charging for an arch, or do you how do you
we can go as I probably am not as low as some people, but 18,000 for a dentist arches is probably about my lowest. And then up to, if they're needing sinus augmentation or hardware, if they need a lot of multi-unit abutments, and that adds up. So I'd say up to 26 to 28 for a maxillary arch, and depending on if it's fixed or not, that also, because we sometimes don't do fixed medias on the bottom. Our workflow allows us not to do that. And so that obviously helps with costs as well.
That's awesome. I want to give you guys each a last opportunity. Is there anything else and here's how I want to kind of break it down. There's all these offices out there. There's all these, especially GP offices, that are struggling, right? They're like, oh, I thought it was going to be easy, but it is hard. It's not easy, right? If it was easy, everybody would just do it. And that's not how it works. So thinking about them as you're saying this, is there anything else that you'd like to throw on the table of this is another thing? And I'll start with you, Nikki. This is something that's really helped me either get more people saying yes, or get more referrals, or get marketing working better. Is there anything else that you'd like to put on the table for our audience?
I think just identifying what makes you different from other offices is a huge selling point. Because like you said, there's a lot of offices doing what we do. And if patients feel that their doctor is not taking the time to answer all the questions, or that the front office wasn't nice when they walked in, I will say that that's typically not the feeling that they get at our office. Usually they say, wow, I just feel like a friend leaving this office once I'm done with treatment. We know about their kids and all of that stuff. So I would say hone in on that. If you're getting into treatment and you're wanting to sell yourself, sell what you're good at, sell what's good about your office. And if your doctor loves, certain things, sell that, tell patients that, and they can identify that as something that then they like about, the dentist too. I always say Dr. Miner and her husband ski, and they've got, kids in college, and just try to find things that are in common with the patient, because that helps make them feel comfortable in the chair.
Yeah. Building bridges, just to repeat back for the audience, building bridges or mirroring, right? Whatever they're interested in, try to connect those dots, but then also, finding out what's unique about you. And everybody's unique in different ways. That's, you're not unique because your office is clean or you have doctors that went to college, right? Like patients already or we're honest. I hear that one. We're honest. It's like, everybody's already coming to the dental office praying that their dentist is honest. So don't use that one. What is the thing that makes, like, maybe you do more full arch than anybody else? Maybe it's our owner doctor is the only one that's doing the full arch. And a lot of that means she's in it, or whatever it may be. So that's awesome. That's great advice. Dr. Miner, how about you?
I mean, without question, just having a great team. Like, as I was learning this and implementing it, it's a very steep learning curve to get to a point where you're just, expectations are good, it's going to have a great outcome, and you're confident in that every little piece is going to go well. And you, as a doctor, I can't do that. I mean, Nikki's fantastic, but we have 2 assistants that are amazing as well. And I got a hygienist who really helps and cares to help educate patients. So it is our entire team that just helps me, the outcome to be what it needs to be for the patient. So
that's awesome, guys. Well, great job today. You guys did a wonderful job, and I really appreciate you guys coming on today.
Yeah. Thanks, Gary.
Thanks.
All right.